everyone, my name's Katie. I am a nurse practitioner and I practice functional medicine. For those of you who are not as familiar with that term, I know it's been thrown around a little bit today. Basically, functional medicine is looking at the body as a whole and kind of trying to heal it from the inside out, looking at it as one piece rather than those broken down individual sections. So we want to look at this as one operating system. What we're going to talk about today is peptide therapy, and it's actually perfect timing with our previous speakers because a lot of what they talked about is how different stressors, and I'll kind of refer to all of those things, the toxins, the gut infections, even the mental and emotional stress, breaks down our system and breaks down the way that our cells talk to each other. So this is one therapy that can be used to actually help restore the damage that happens to your cells from a lot of those stressors. This is just showing I don't have any affiliations with anything discussed today. Okay, so what are peptides? Peptides are chains of amino acids. So you might be familiar with the fact that amino acids create proteins. When amino acids are in chains shorter than proteins, those are peptides. So your body creates thousands of different peptides, and the idea here is to help that cell-to-cell communication. When we're exposed to all of the stressors that our previous speakers have been talking about, that cell-to-cell communication actually breaks down. So you think about breakdown in any relationship, a friendship, a marriage, what's number one, right? Communication. So you can kind of think of peptides as like a marriage counselor for your cells, right? We're getting them to talk to each other again. So we want them to be producing the proper peptides and then also for your cells to be receiving those peptides properly. Peptides are a little bit different from hormones. Hormones are also going to be kind of the way that your body is talking to each other, but they're more kind of this regulatory and looking at that homeostasis and that balance in your system. Okay, so here's just a little visual so that you can kind of understand a full protein is going to be a whole bunch of amino acids, and a peptide is a chain of fewer amino acids, typically anywhere between 20 and 50. Okay, so how do you know that peptide therapy would be right for you? A lot of people think like, oh, I'm not sick, I'm okay. I think Dr. Koop kind of mentioned that in his speech too, where you think you're just moving along and your health is doing really well. I always tell people that before I started my health journey, if you would ask me on a scale of 1 to 10, what is your health? And I would probably say a 9 or a 10. Once I started actually digging into that, I would look back and I would say my health at that time was probably like a 2 out of 10. So I think sometimes we don't realize that when we're exposed to these toxins, we're exposed to emotional and mental stress and different GI pathogens from our food, we are actually sometimes not functioning as well as we think. A lot of us assume that fatigue or pain or broken down mental clarity, that these things are just normal, they're just part of life. But they shouldn't be. So peptides can be helpful for people who think they're healthy currently, for people who are healthy and are looking to optimize that health and just kind of thrive. Peptides can also be really helpful for people who are really chronically sick. So this is kind of just showing the process of how you would utilize peptide therapy, and I think it's maybe one of the things that keeps people from wanting to try peptide therapy is that it is an injection. There's one peptide that can be compounded into an oral solution, but the rest of them get broken down in the gut. So what we want to do is just tiny little insulin needle, and it goes right into the fat layer under the skin. So it's pretty simple, it's not painful, and as long as you have a well-trained functional medicine provider showing you how to do it, it's actually very simple to learn how to do these injections yourself. Typically you're going to be doing them like 4 to 7 days per week at home, being on therapy for 4 to 6 weeks, off for 2 weeks, kind of reassessing how you're doing with everything, and then determining if you still need to use the therapy going forward. So this is the one peptide that we'll talk about more in depth because it helps more people, I think, than any other peptide. It has a lot of versatility, and we kind of talked again a little bit in some of the earlier speeches about that gut breakdown and how common it is for people. So BPC 157, and all of these peptides kind of have goofy long names that are difficult to remember, but if you remember that BPC stands for body protective compound, that makes it a little bit easier. So your gut actually produces BPC 157. What it does is it increases that cell-to-cell communication in the gut, and it helps your GI lining to repair that breakdown in the cells. So we saw the picture earlier today that kind of explained that leaky gut process where the cells become more permeable and now our toxins and bacteria can kind of seep through and get into your bloodstream. So the BPC 157 is helping your body to heal those connections. It can help with healing for irritable bowel syndrome. It can help with healing from Crohn's and celiac. That's not to say this is going to be a cure for those things, but it's going to help heal a lot of that damage that has occurred over time. Skin issues are a really big thing that I use BPC 157 for. So I actually have my 4-year-old niece. This is the one peptide that can be compounded orally. I have my 4-year-old niece on BPC 157 for severe eczema. Within 2 weeks of starting therapy, she had a 40% improvement in her symptoms, in her itching, no longer waking up bleeding in the morning, just really life-changing for this little girl. You'll have to excuse my breathlessness, I am about 9 months pregnant. Thyroid healing, so people who have hypoactive thyroid, Hashimoto's, BPC can actually help that thyroid tissue to heal and help the signaling of your thyroid hormones as well. And then also injuries, so tendinitis, tears, ligament issues, even post-op and pre-op for surgical patients. I'll frequently use BPC 157 so that we can get those signals talking to each other better and get people healing more efficiently after their surgery. So this is just looking at a study that was done, an animal study on BPC 157 that showed significant improvement in our tendon fibroblasts using BPC 157, up to about 50% improvement, and cell survival under stress. And I think stress is kind of that common theme that we see talked about today. So no matter what, none of us can escape this toxic world, and if we can improve the way that our cells receive and manage stress, we're kind of just giving them a little bit of extra help there. So other uses for peptide therapy. There are probably about, right now, 30 to 50 peptides that can be synthetically compound that we can use as treatment for patients. So these things cover a whole wide range of what we can treat. Some of the most common things that I use them for are autoimmune patients, so rheumatoid arthritis, chronic fatigue, pain issues, lupus, Hashimoto's, chronic infection patients, viral patients, patients who have just terrible insomnia. I think that's another thing that a lot of us deal with, our sleep issues. So there are deep sleep inducing peptides. Peptides to help improve your cognition and your mental focus, kind of help with that clarity. Again, we talked about like the irritable bowel, the Crohn's, the GI healing, hormone production and management. That's kind of a common thing that we see in today's world, is a breakdown in people's hormones, again, because of the stressors that we're exposed to. And we can also wean patients off of some of those more damaging medications that we find ourselves almost getting stuck on sometimes. You look at like NSAIDs and proton pump inhibitors, they can break down that gut lining over time. So I've had a handful of patients who see me for chronic pain issues or chronic digestive issues, and they kind of get stuck in this place where they're feeling that they have to use these medications because it's the only thing that keeps them symptom-free. So we have really great success getting patients, weaning them off of these meds by using peptide therapy to help with that transition time. Safety. So Europe is maybe a little bit ahead of us. They have several approved peptides already. In the US, there's a handful of approved peptides that we can use in patients, and then hundreds more that are undergoing clinical trials right now. When you look at side effects, majority of these peptides, the biggest thing is just that site redness and swelling. So we know that we're injecting, we're penetrating the skin, right? Anytime that you're doing that, even if you're being clean, there's always a risk for infection. So that's really the #1 most expected side effect from peptide therapy. And again, while they're extremely safe to use and there's a very low side effect profile, it's definitely important to be monitored by a provider while you're using peptide therapy. You can find them online. I don't recommend it. Most of them are sourced from overseas. They have DNA fragments in them and they're not the safest to use. But what I recommend doing is finding a functional medicine provider who can prescribe them for you from a pharmacy. There's a couple of pharmacies in the United States right now who are compounding peptides, and that is definitely the safest way to do them, and that is the situation where you're seeing low side effect profile. So this is again just kind of explaining, don't buy them online. Definitely get them prescribed from a provider. You want to make sure that you're being monitored. And this is not a therapy that we're looking to be on forever. So this is something that can help bridge, again, get you off of medications or help to heal that leaky gut, help to heal from that autoimmune disease. So really, again, back to that idea of what is functional medicine. Functional medicine is healing the person from the inside out, and that's really the goal of peptide therapy. And there are hundreds of other therapies and modalities that we can use in functional medicine to heal from the inside out, but this is just one of my personal favorites, I think, because it helped me get so much better from those health issues that I was working through. So I get really excited to talk about it and kind of spread it around to people. I think it's one of the lesser known therapies, and so something that we can all benefit from. And these are just kind of the references from the different studies. And if you have any questions or are more interested in peptide therapy, I'll be around, so I'm happy to chat about it.